CDSMP collaborative meeting. And if you would, we're going to do some quick introductions, a little bit of a roll call. And then if you'd mute your phone, that'll help with the background noise. So thank you all for being here. And we are going to move forward. I'm going to start my slideshow, hopefully. Well, maybe I'm not. Click on 2. Well, it's going well so far, don't you think? Okay, now I have a stuck PowerPoint. This may be a very dull webinar here. I'm going to put Jody to work on it while we're doing this. Let's go ahead and start with who's on the call, and then we will hopefully come back to this. So on our call today, let's see, is Connie here? Okay, not yet. And I saw Brittany came on?
Yeah, I'm here.
Great, thanks. And let me see, I saw Susan, you're on the call?
Yes, I am. And Ellen.
Hi, Ellen.
Hi, Lindsay.
And Ellen is the person who is going to be taking on the activities that Susan's been doing, although Susan will still be around. Would you like to explain that better than I just did?
Well, I'm retiring the end of June, but that doesn't mean I'm out of sight, out of mind. I'm still going to do some contract work. So I'm still going to stay involved.
Good. And let's see, I heard Danny come on the call.
Yes.
Danielle, are you there?
Yes, I'm here. Can you hear me?
Now we can, yeah. And would you like to tell us, introduce yourself? And
Sure. I'm Danny Pearson. I work for the Weld County Area Agency on Aging. Holly had a strong people class this morning, so she couldn't listen in. So she asked if I could, and I'm one of the CDSMP leaders here.
Great. Well, we are very glad to have you with us. And as you can tell by my screen, I'm still trying to figure out why we can't get a PowerPoint to work, but we're going to keep going. And let me see, is anybody here from Boulder County? And I saw Katie's here.
Yeah, I'm
Katie,
here.
are you with us? Hi.
I am. Hello.
Nice to have you with us.
Thanks.
Do you know how to fix my PowerPoint?
I do not.
Okay. Okay, I'm going to try closing everything else down and see if I can get it. Okay, there we go. We got the agenda up. There's the sign. Yay. I have no idea why this is not working for us this morning, but we will. Oh, there we go. Oh, for goodness sakes. It's a miracle. Okay, there's our agenda. Let me see, who else is on the call that we have missed? Kelly, are you here from AHAC? Okay, is there anybody else on the call?
Lindsay, did you hear me? This is Flora.
Oh, no, Flora, I didn't. Thank you.
Okay, yes. And it'll just be me today from CDPHE. Kelly can't hear me today.
Great, thank you, Flora. And anybody here from Tri-County? All righty, well, from COA we have Joni Saunders is here and Cheryl Wakefield, who is our ACE minutes taker, is here. And did I just hear a couple more people come on?
This is Mary Pat.
I'm sorry? I couldn't hear who that was.
It's Connie Young with Department of Human Services.
Okay. Somebody's got some feedback going. You might want to mute your line. Great. Thanks, Connie. And who else joined us? I believe they have their phone and their computer monitors on? So getting great, that's better, thanks. And I also believe Mary Pat Gallus is with us now from COA. Is there anybody else online? And it's still sounding like we're getting some feedback when anybody talks. So you might want to just double check if you're using your phone speakers, then you'll want to turn the speakers off on your computer. So we'll go ahead and get started. First thing we want to do is just welcome some of our new folks. So Ellen is here from University of Colorado Health Center, and that's in North Campus, Susan Milligan. And Danielle is here with us from Wells County. And I believe those are the two new folks that we have on board. And let's go ahead and just start with the regular updates. As you all know, we've got a lot going on in the state, and the collaborative, the purpose of the collaborative is to work not only with one particular funding stream, but to take a look at best practices and what we can do across the state to further embed and sustain and grow the chronic disease self-management program. So that's our reason for being here. And we tend to focus a lot on some current funding, which is through the AOA grant. And so we always include an update on what's happening with that. So I'm going to turn it over to Connie, because I know we have a couple of updates on the current big grant we're all working with, which is the AOA Year 2. So Connie, you want to take it?
Sure, thank you, Lindsay. So what Lindsay has on the agenda is, for the first item is some good news, which is that I did get an email from our grant manager in DC that we are getting Year 3 funding, which we expected, but it's nice to hear that. And so I had to put together a budget real quick and for Year 3 and a new work plan. So the funding is about the same as Year 2, so it's good that it's not less. So that was good news. It's not the official notice that we need in order to do contracts or anything, so I'm hoping that that will come earlier than it did last year, because we can't do anything formal until that happens. But it was good to hear early on that looks like we'll be funded for the 3rd year as planned. The next item that Lindsay has on the agenda there is, I guess, a little bit of bad news in that I'm not prepared to have we had talked about the next item on the agenda, in case anybody doesn't have that webinar opened up, is the in-person meeting update. And you all can decide to have an in-person meeting whenever you want, but as far as reimbursing for mileage, we had talked about doing that when we have the sustainability consultant on board, and I will not have someone by June, which is when we had talked about last time. So I apologize for that, but two issues that have gotten in the way this past month were the item A, which was the Year 3 funding, which is good, but having to devote time to real quick, like, try to put together a thoughtful budget and work plan for next year. And then we are also statewide and in Colorado state government and implementing an entirely new accounting and contracting and computer software system. So that may mean that I need to wait until July to start the person, because that's kind of complicated, but that's when that goes into place, and we're sort of in this limbo right now, so it may make it a little bit harder to get somebody on board before that. So I'd like to open that up for whatever your discussion, but as far as us doing an in-person meeting, that I could use the grant funding to pay for travel reimbursement for people to come to Denver, and to have a sustainability person on board, I would say July is likely, July or August. So I wanted to see what you would all like to do, whether you want to come together twice, once on your own dime and then once on the grant funded travel reimbursement. So we could still come and have a meeting in June and then have another one in either July or August that would be paid for by the grant, or we could just wait and do July or August with grant funding.
Connie, this is Lindsay. My memory is that we wanted to, because of everyone's tight budget, that we were feeling like we needed to wait until there was reimbursement available for those folks coming from outside of Denver. And so I guess I'm thinking if we need to wait till August to do that, that might be preferable to taxing people's budgets. But I'm open to either way. I do know we want to do it before it gets snowy again, which sounds really weird considering it's spring, but but I know how it works. So
yep.
What do the rest of you think?
Hello, this is Flora. I think it'd be good to send out like a doodle poll just to see what people are thinking in terms of date. And I don't know if the consensus is to have it in Denver, or maybe even if we are doing it in August or July and it's still nice weather, it might work to do it somewhere closer, like in the ski resorts when the deals are great, because it's not ski season, and then that way it's only an hour and a half from Denver, and then that might be more accessible to other people. So I don't know, those are just some ideas, but I think doing a poll where people could really weigh out their options might be more efficient.
I think that's a real good idea, Flora, and I also know schedules are getting full now. I mean, I know I'm traveling part of August and already have something booked in September, so probably the soonest we could look at getting dates and locations figured out, even if it is a few months away. That makes sense to me. Is that something that would be doable, Connie?
Well, the issue of location came up before, and it's always a tricky one because, you know, some people are, it's going to be farther for certain people to travel no matter what we do. I based the budget on having the meet in the Denver metro area because that would involve the least amount of cost, because so many people are close to Denver or within a, you know, could travel to and from Denver in a day, depending on how we're going to do it. But it just gets really, I was really surprised even at that. It's $3,000 for one meeting. That may be a little bit less because some people that I put in for overnight travel may not need that, depending on how we do it. But I think we're going to have to stick with Denver Metro as far as when we, you know, for my budget on the grant for mileage reimbursement. So if you want to do something another time when other people are, you know, one of these calls we talked about it, and some people said they could afford one meeting a year to pay for their own travel. So not speaking for everybody, but you know, that would be a possibility at another time. But as
so
far as when we would, I'm sorry, but I did talk about doing a poll about whether to do the meeting all in one day or to split it across an afternoon of one day and the morning of the next for people who are traveling long distances. So that part we can still do. And as far as what actual date, that's okay with me to do that, and it would also depend on our consultants' availability. But location-wise, and sorry, I think we're going to need to stick with Denver just because of cost.
And Connie, am I remembering right that the only way, in terms of reimbursement, is it needs to be connected to having the sustainability part of the meeting?
Yes.
Okay. So the question is, do we want to try and, I guess one question is, do we want to go ahead and set an in-person meeting without reimbursements available? Or do we want to wait until we can have reimbursements available and connect it with a sustainability piece that's tied in with the funding? Don't all talk at once now.
I think we wait. You know, June is just upon us, you know, so close. And I think if we wait until July or August, it just makes more sense. But that's my opinion.
Thanks, Susan.
Anybody else? You know it was me.
I know your voice. I know your voice. And your laugh.
Okay.
Hi, Lindsay. This is Monica. Can you hear me?
Hi, Monica. Yes, I can.
Okay. I'm sorry I had headset problems, so I just had to come in by phone. So.
Oh, okay. And did you want to weigh in on the meeting question?
Yeah, for me, honestly, it really doesn't make a difference on my side as long as I know ahead of time. I'm pretty flexible, so with my time, you know, I mean, I'm busy all the time, but if I know ahead of time, I can work it in.
Okay. Okay.
And Lindsay, this is Crystal and Eve from Southeastern Colorado AHEC. And hello. I think for us, our schedule is filling up so much. I think having one with the inclusion of the sustainability would work best just for our scheduling. So just our thoughts.
Okay. Well, Connie, it sounds like we're going to wait until we can hook it with the sustainability piece.
Okay. All right. Well, I will should be able to make some progress on that in the coming weeks, and then figure out whether July or August would work. And I guess should I assume that this is a little premature, but when I am getting the consultant, can I open the possible dates up a bit other than the first week? Or
I think you're going to have to, probably. You might want to do a meeting doodle to just get a poll from everybody on when they're available. I know.
What I was thinking, maybe if I opened it up to when the consultant is, and if they have some constraints, then within that, I could poll people. Would that work, do you think?
Sure.
Okay. Okay.
Yeah, that would work.
I'm sorry, it's kind of up in the air, but that's the way it is right now for various reasons.
Okay. Okay. I just, yeah, we'll just wait and see what we can find out with the consultant. So that'll work.
Okay, thank you.
Do you want to give an update of what's going on in Grand Junction and Dr. Cobb?
Sure. We had in the original grant proposal was a plan to have presentations done about CDSMP to the area agencies on aging that had demonstration projects funded by, I think it's by CMS, the Centers for Medicaid and Medicare Services, with the AAAs that had community-based care transitions programs, which are, you probably all know what those are, but for anybody who doesn't, basically trying to make successful, help Medicare members who are hospitalized and then are trying to return back to home after an incident where they had to be hospitalized, successfully transition back home and being able to stay in their own homes. And so they have a very a short-term program that helps people make that adjustment back to home. And then the idea was that CDSMP grant would be an opportunity to help those folks after that first month of being back home and get some of those folks in classes to help them over the longer term. So anyway, we are now making plans to do presentations in 2 areas. It's broadened in both areas beyond just the community-based Care Transitions Program.
Easy for you to say, Connie.
Yeah, I know. I'm trying not to use too many acronyms because, you know, not everybody uses the same ones all the time, and it's hard to remember what they are, but it's hard to say the whole word, which is why we have the abbreviations or acronyms. But in any case, I'm working with COA to do 2 presentations that have evolved from this idea, and one is in Grand Junction, one is here in Denver. The one in Denver is with pretty much exclusively the Denver Regional Council of Governments, or DRCOG, which is the Denver area agency on aging. And so it will be for a lot of their staff. It will be about the community-based care transition program, but also broadening into all of the services they provide for older adults and adults with disabilities, so that they're aware of what CDSMP is and hopefully can make more referrals of their clients to CDSMP. So Lindsay and Mary Pat, well, Mary Pat's going to this one, right, Lindsay?
Mary Pat will be at the one with DRCOG, yes.
So they'll be talking about what CDSMP is, when the best time to make a referral is, how it can help, giving some scenarios of people they've worked with before in classes, success stories, and having the group brainstorm, you know, what their role might be in this whole process. So that's in June, the June 12th, and then the one before that is broader in focus than just the area agency on aging. They know the one in Mesa County no longer has their specific demonstration project funding going, so it's really broadened, and Brittany Newton and Sue Connery have been helping us with designing that whole presentation to reach home care providers and the physicians and medical practices that Brittany works with, as well as the AAA, as well as the hospital, and the disability community as well. So that one will be a little bit broader in focus, but the same kind of idea. So hopefully both of these will help us get referrals into CDSMP, and that one I think I said was May, well, it says right there on your webinar frame that it's May 9, so that's next week. And just FYI, Lindsay, I did get a RSVP from the Executive Director of the Center for Independent Living, who's planning to come from Grand Junction. So that'll be great. Yeah, I think that'll help us start reaching the disabled community. And I also have invited the vocational rehabilitation counselor and supervisor in that area.
Do we know yet if Dave, the AAA director there, and his staff are going to be with us? I sent the email again yesterday as a reminder because I hadn't heard from them, and I haven't heard from them yet this morning. Okay. But I think so. I mean, I don't think they've RSVP'd to Brittany yet, and then I hadn't heard, so I sent a reminder yesterday. So hopefully, so I will. If I don't hear, I'll get in touch again. Great. Well, I know Brittany and Sue have been wonderful to work with on this, and we're hoping that this will really, really help their community realize what great resources right there in their backyard. And I'm hoping this will really reacquaint people that maybe have forgotten, because you know you have to kind of stay in front of people on what you're doing, because they tend to move on to the next thing. So hopefully this will help them. And then I know part of what you've been looking at for year 3 funding is the possibility of doing other presentations like this, possibly in other parts of the state. So if you're thinking to yourself as you're hearing the call, boy, I wish we had something like that, now would be the time to say something to Connie as she's putting the budget together.
Well, it is put together. It could change slightly, but I did put some funding in there for that. And yeah, I think it would be great to see how it works. I can't imagine that it would not be successful, because if people come, then they see named people, and they associate you all with with CDSMP, and then have a more of a connection to it. So I'm really hoping that will be effective. So we will see. But yes, we're hoping to do a little bit more of that next year.
Great. Well, Connie, I know you've got one more thing you wanted to talk about. Do you want to do that now, or do you want to wait for the marketing part, or you want to go ahead and do it now in case we lose people later?
Sure. Yeah. It's kind of a quick one, but I know you all have success stories of individuals who've gone to CDSMP, and if you would like to showcase that any of those stories, we have been asked down from the governor's office to send success stories up to our department director, who then forwards those over to the governor's office on a monthly basis, I believe it is. So if you would keep those in mind, and what would be ideal is that the person would be willing to let us use their name and a bit of information about them, and if they are willing to do that, then they would need to sign a release, which I do have, and it spells out what exactly how the information would be used. Next best would be their story with at least a first name, and if they don't want to use a name at all, we probably could still forward that up, but those are sort of the best case scenario would be someone who'd be willing to share their story and their name and all of that. But it would be good for, might be fun, you only want to do it with someone who wants to do this, and a lot of people, I think there are a lot of people that do want to tell their story and how they've gotten better, and they're grateful for the opportunity and all that. If someone's ambivalent, I certainly don't want anybody to be any arm twisting, of course. But so for people who are interested, it'd be something positive for them and something positive for CDSMP in terms of getting more attention, at least in the government sector, and something good for your local program as well. And you never know when things go up the chain to the governor's office that where else that could lead. So if you ever have any, if you have people that you think might want to do that, let me know. If you have questions, let me know that too. You certainly can touch base with me before before doing that. But that was a great opportunity.
Okay, great, thanks.
Thank you.
Well, any questions for Connie before we move on? Okay, well, one of the requests that was made was to kind of tweak how we were doing this centralized referral system reporting. And so what I have done is just put together a spreadsheet. So what we are doing, these are all of the referrals that come through Self-Management Colorado. And all of those include things that are direct referrals, like someone goes onto the site, they use the secure email to send us a referral, or they send us a fax that they downloaded from CDS or Self-Management Colorado. The other thing that happens is they go on the site, they look around, and they send us an email, which comes to me, but it's generated through, I can tell it's generated through the Self-Management site versus through the COA site. So what we are doing is tracking all of those, and occasionally we also get a phone call from someone who saw the website, they talk about it, and they know we can figure out from what they're saying it's the collaborative site, so they give us a call, and then we put all those in. And there's also a couple of phone calls in here that were generated by someone Connie spoke with, and then Connie let us know and we followed up. So what I have here on the spreadsheet, because the question was not only how many were we getting, but where were they coming from, what did we do with them, and then what classes did they go into. So I have an overview I'm going to give you at the end, but I wanted to show you how we're tracking this, and hopefully this won't be too little to see on your screen. I've taken out all the protected health information, and so what we do is we run a referral system that has all of that in it so that we can track all the contacts we're making, how many times we've called them, if they emailed us initially, how many times we emailed them back. So we're tracking all that stuff, but what I wanted to do is pull for you this information. So these are all of the referrals that we have had since January of this year. Now, these are not huge numbers, and part of the reason for that is that, as you know, we are not necessarily getting a lot yet from any place except right in Metro Denver and right with the couple of agencies that we've talked with. So, for example, we have one up here that came in January. That was actually a call that we received. It was an SUA referral source, meaning Connie. And what we did was email and call them back. And we've been working with them now for this woman for since January. And she was not interested in attending a class, but she's training to be a leader. She's found another person to co-train with her. And they are going to be doing classes at a rheumatoid arthritis clinic. So people that have rheumatoid arthritis, lupus, associated conditions are going to be the groups that they're working with. So they're signed up and they're going to be training to be leaders in June, which is terrific. The next one is this is a referral that we received by fax from Colorado Access. In this case, there was no response at all. We got the referral from Colorado Access. We attempted to call repeatedly. We never got through. They didn't have a voicemail, so we marked it inactive. Now, what we also do is we let all of these folks know where they're at. So in Colorado Access's case, we were able to tell them, this is when we tried to call and what happened. So they're very aware of where things stand with the people they're referring. In February, we started getting also referrals from A.F. Williams. And initially what we were trying to do was to get the A.F. Williams folks into other classes. So, because we did not have any classes on site. And A.F. Williams we met through one of the RICO presentations. So, although they are not a separate RICO, they are an entity we met directly through the RICO presentations. And A.F. Williams is serves primarily almost 100% of their folks are Medicaid clients, and so I'm reporting those here as well, because initially those referrals came through Self-Management Colorado. And we were able to get one person into a class at the Wheat Ridge Adult Center. That person attended class and made 5 out of 7 classes. And I mention this one specifically because I only put a few of their conditions in here. Sometimes on the referral forms I don't have a lot of the information, but this person had breathing problems, COPD, anxiety problems, depression problems, lupus, fibromyalgia, and several other things I had never heard of before. But this person not only went to class, but was a completer, which is very exciting. There's also a couple people on here that we received email referrals from through either Colorado Access, referred them to the site, and then they emailed us from the site. In this case, this is one person. There are 3 that we've referred to Susan for her chronic pain program. And one of them is a very recent referral, which I'll show you in a minute. One of them did not attend the program, and one of them not only attended but completed the program. So that's very good news. And so this, the others that, when it says in this enrolled column, yes means they are in a class, working means we are still working to get them in a class. And sometimes that takes a really long time, as those of you know who have done this before. So we've also had some folks that have been A.F. Williams clients and are now coming through the website. But they have, A.F. Williams has a class, 2 classes actually they've set at A.F. Williams. So we worked with them on setting up their own class for their own patients, which initially we weren't sure how that was going to work because they draw from all over the metro area. So what the plan is if they are calling from outside of the metro area, we're helping them connect with classes closer to them. But we're also trying to get classes going at A.F. Williams. So we've had a class that was a chronic disease self-management program class, and we have a diabetes class that's starting in late May. So A.F. Williams is doing a lot of their own internal referrals. They're sort of embedding the process internally. And at the same time, some of their folks are sending the referrals still through Self-Management Colorado. So they're kind of doing a hybrid thing at this moment, which is not unusual. So we have a couple more working on this page. We also have four other folks that were enrolled out of A.F. Williams into classes starting in May. And then we also have another voc rehab person that was referred on to Susan and to Ellen at this point. And then this is the last grouping we have, and these go, oops, I did not go forward. Let me try the next one. There we go. Okay, and then we just have a few that were toward the end of April. And again, one of these was from A.F. Williams, one is a new one from Colorado Access, and one is a person who was searching the web and sent us an email from their site. And that's the one, the most recent one we sent up to Susan for the chronic pain program. So we are slowly making progress, but we still don't have huge numbers, in part because the only things that we have used so far to refer people, to drive people to this site, are those RICO presentations that we worked with. We also made a real effort to connect people when we were doing the work with the RICOs to programs that were close to them. You may remember that with Weld County, they were trying very hard, they being the regional care organization, to connect their diabetes patients to a diabetes program that was running in Weld County. And unfortunately, I talked with Holly about this yesterday, they didn't get any direct referrals. There was a lot of conversation about it, but the timing didn't work, and so it didn't work very well. But this is where we are at this moment. And the reason you're not seeing a lot of this from other parts in the state, both the RICOs that we were working with were Metro, Denver, and north into Weld County. So they had very limited reach in terms of the whole state. So far in 2014, we've had 18 referrals. One of those is totally inactive, meaning we have reached out repeatedly with no way to connect. So that one's done, more or less. We have 8 that are still in progress, or as we call them, working. 9 of them have enrolled to date. One of those, and one of the questions was which license holders saw these numbers. So one enrollment went to, and that was a completer, went to Susan's program, University of Colorado Health North. One of them was in a CNI in Lucy's Colorado Neurological Institute program, and it was actually a Kaiser referral, and because the Kaiser classes weren't working time-wise, they were able to, we worked with them in order to get them into a CNI class. One actually went through a COA class and was a completer, and 6 are currently enrolled through the website. There are larger numbers enrolled for the class starting in a couple of weeks, but 6 have enrolled in A.F. Williams classes. And those were classes that we did set up through COA, specifically on-site at A.F. Williams, which is in the metro area. So that is what I know. That's our spotlight on where those referrals are going. So any questions? Have I put you all to sleep?
Hey, Lindsay, this is Crystal. I was in a meeting yesterday, so that's not a question necessarily, but I was in a meeting yesterday with some folks from RICO down in this part of the state and other folks just talking about health information technology, and I was able to give them the website, and they were sending it out to their provider contacts. So
great. Hopefully
that'll drive some more traffic to the website.
That would be fantastic. And then what we can do is plug them into your classes. That would be fantastic. And this is a really good time. Thank you, Crystal. You just set this up real nicely. You're welcome. It's really important that we know when your classes are. And I know that most of you that are on the phone with us have been really good about that. If there's anything that you sent to us that was a to-be-determined date or anything like that, when you know when those classes are set, let us know, because that's how we get people into your classes. So, thanks.
Hey, I have one other question, Lindsay, and I know this is the CDSMP, DSMP collaborative. Somebody yesterday asked why, or if there was any way that when DPP classes are offered, I don't want to muddle the website at all, but I don't know if there's any way, at least when those classes are listed, if the providers are looking for classes in their area, if there's any way that DPP could be added. And that may completely muddle everything, so I don't know, I'm just throwing it out.
Yeah. At this point, that would be a whole separate funding issue because we'd need to do some programming changes and some other things like that. And because the programs are run so differently, and because of how we have the agreement set up with the collaborative and things, I think that would be a really nice long-term goal, because we've talked about how nice it would be to also have falls programming on there too. And I know on our COA site we have, we are able to do that. The collaborative website is not set up the same way at this point. So, so it's a big firm maybe. Sorry, but it really comes down to a funding issue, and yeah.
This is Connie, and not a question, but just a thank you to presenting this in this table form and going through it. That's very helpful. Thank you.
Oh, good. Thanks. I would love to have like zeros after all these numbers, so we could say we had 180 referred and 90 are in classes. This actually, I will tell you from those of you who have been working referral systems, to have 50% of the referrals going to classes is very good. Especially these are not the easy classes to fill, and these are not usually the easy referrals to work. Sometimes if you're working with somebody, and we've worked with practices where they're very connected to their physician, and their physician says, we want you to go to this class, and they make the referral, and then it's pretty much an easy slam dunk. We just have to get them enrolled. What happens with these referrals is a lot of these folks are not used to working within the health system and are not familiar at all with concepts like self-management. And so it is, so I just give kudos to our staff because they work real hard to get these folks into classes. So thanks. Well, any other questions, comments before we move on? I really don't want you guys to go to sleep before we get through the meeting. Flora, you want to talk data? Because that'll excite everybody.
Can you hear me? Hello?
Just barely, Flora.
Okay, I had to put myself on mute. There's a lot of background chatter over here. Yeah, I don't really have anything. The data, the workshop packets are coming in. We're starting to get a lot more consistent ones, and mostly in physical packets mailed instead of the emailed ones, but that's fine either way. Since we haven't had any updates from NCOA on any data changes, it's just everything as usual. Does anybody have any questions? Well, I'll be on the call if you think of any questions until the end of the call.
Thank you, Flora. That's really good news, isn't it, that there's no changes from NCOA?
Yes, for a while there it seemed like there was a lot of stuff coming down, but it's been pretty steady for the last.
Yes, our monthly review of all the changes. Yeah, I was rereading some of the minutes, and yeah, this is nice. But thank you, Flora. Mm-hmm. Now, for those of you who are missing those monthly updates on all the data stuff, if you go to selfmanagementcolorado.org, then there now is on the website not only the webinars as we're going through them, but there's copies of the minutes, and there's also the webinar on privacy that we all did in so there's ways to do that, and so it's all there if you need it, as well as some other forums and other information. So just wanted to move on now to the different trainings we know are coming up. And Monica, are you on the call? You want to talk about your training?
I am, Lindsay.
Okay.
Well, we do have the training coming up in May. So if anybody's wanting to send anybody over, that would be great. We still have some openings. We have a good response so far, so hopefully they can all make it. As far as training goes, that's what we're looking at. We're possibly looking at another training towards the end of the summer also. I don't have dates exactly, but hopefully we can get something else going then also. But I will let you know as soon as we do. That's about it on trainings.
Well, I know, Monica, you've got some folks coming up from Trinidad to train, and I know you have Alamosa folks. Where else? Do you know where else people are coming from?
We've got 2 coming from Del Norte.
Oh, great.
Yeah, with one of the clinics over there, which is good because we've been trying to get them on board. And
Monica, do you know what health system that is, or?
It's Rio Grande Hospital Clinic.
Okay.
Out of Del Norte. So, and then let's see, we have. Actually, this is really exciting because quite some time ago at our last training, last July actually, we had one participant from one of our diabetes classes that became a leader. And now with this training, we've got 2 participants that took part in our diabetes workshop in Del Norte are going to take part in this training also. And so for us, that's pretty exciting because I think it says something for the workshops that we're putting on and for the program
Connie,
itself.
you could put that in your monthly report. I think that'd be great to highlight.
Which part of that?
About I'm sorry.
No, go ahead.
Okay, about bringing 2 of our diabetes or DSMP workshop participants coming in and becoming leaders in the program. And then we had one last July from a DSMP workshop that we did that became or was trained as a leader last July also. So this will make 3 participants just from the workshops that have been out there. So, you know, kudos to the program because, you know, it really is an awesome program.
Yeah, and just to interject, Monica, if any of those individuals would be willing to share their story publicly with their names, especially, that would be great as far as being able to send that up the chain here as a success story. And then there's also the possibility of doing some local media if they're, you know, they really need to be willing to be public no matter which way we do it. But if you want to check with any of them and let me know, that would be great.
Okay. Yeah, I've written some names down thinking, you know, some people from the different areas of the valley that have, that I'm sure would do that. So.
Okay.
So, yeah, it's kind of been a long road, but we're getting there. And but it's all been positive, so yeah, I'm pretty excited about that.
Yes, and
so
I think
Monica,
I'm sorry?
I was just asking how many more spots do you have left? I'm thinking of the people that came to the Durango training, and I'm thinking maybe they had some colleagues or coworkers that were interested, and maybe even some of the tribal members if they could make it out there.
Yeah.
I would let them know if you still have a few spots left.
I do. Let's see, right now I've got 8 that are signed up.
Okay.
So we've got 4 for sure, because I think the maximum was 12. So 1 was questionable, so maybe 5, but 4 for sure.
Okay.
Spots that would be open.
And it is a leader, right? training?
It is a leader training for, it is a CDSMP with the crossover for DSMP.
Okay.
Yeah.
Great. Thank you.
You're welcome.
Well, that's wonderful. Congratulations.
Thank you.
So in terms of other trainings we have coming up, CO is doing one, as you know, in Lakewood in June. We already have a few people signed up for that. And we also will be doing a diabetes cross training at some point after that. But this is the one we have in June. And then the only other one that I have that is on that, and we'll open it up, is we're doing again the workshop on implementing evidence-based programs in patient-centered medical homes. And we did this one last year and had people come in from many states. Actually had a lot more people from out of state than we did from in-state. But it was a real good 2-day workshop, and we're doing it again. We have people come in that are running programs in different states who come in for this. Part of what will happen is we start off with what we call a virtual site visit, which is a wine and cheese reception, which you guys will all get an invitation to, and it's free of charge. We just want you to come. And it's wine and cheese at the Sheridan West for a couple of hours, and then we will show videos of the different patient-centered medical homes that we have started working with. So it includes community health centers as well as private practices that talk about how they do referrals, how it works, success stories, that kind of thing. So I would, it's an open invitation. I mean, we'd love to have you at the workshop too, but we for sure come join us for the fun part before we get to work. And we do have coming in to co-present Albert Trevelyan, who's the new senior director with the National Council on Aging, whose job is to do community clinical connection, and Mary Brick, who's with the Center for Disease Control's National Association of Chronic Disease Directors. So, and this does, Crystal was asking about diabetes prevention. This workshop does address evidence-based programs overall, not just chronic disease, but implementing diabetes and falls prevention, and et cetera, et cetera. So that's my plug on that. Are there other trainings coming up anywhere that are scheduled?
Yeah, Lindsay, this is Crystal, and we have two. We have June 26th and 27th, a DSMP cross training in Pueblo. Okay. It'll be $99. And then we have a CDSMP, DSMP training in August, the last week, beginning August 25th, and we're doing that for $299.
Okay.
And that'll also be in Pueblo.
And that's a CDSMP, DSMP?
Correct.
Okay, great. Well, we'll add them to the list and we'll get them on the website.
Perfect, thanks.
Great. And while you're there, Crystal, I have a question. You all just got some funding, am I right, to work with the rural hospitals? Is that the project that you're working on with all the trainings?
You know what, we work with some of the, it's through the Colorado Rural Health Center, so we work with 14 hospitals around the state, and so we are trying to get them into the program, and I think two of the folks that Monica referred to in Del Norte at the clinic, we were trying to get them also, so I'm glad to hear she got them registered for her class.
Good. Yay. Well, I think this it gets kind of interesting when, we're working with community health centers, you're working with rural hospitals, a number of us are working with patient-centered medical homes, and so Joni and I had the experience just this week of being with a practice that we talked with when we were involved with another project a year or so back, and now we're back because of a different project. So it's always kind of tricky to figure out how that stuff works. So I'm glad the more we can share information on those dates and times, that's terrific. And you did say the 25th is when the August one starts.
Yeah, August 25th. Yeah.
Okay. Great.
And you know what, Lindsay, I've been in contact with Josh there at COA. I know 3 of the hospitals and clinics we work with are they're Yuma, including Yuma, Holyoke, and Sedgwick, and so I'm working with Josh, and he's connected me with one of your contacts there, just because we don't want to step on toes, so we're trying to be cognizant of that and make sure that we're talking with the appropriate people in the community so we're not causing any frustration there whenever we're down here.
And I appreciate it, and I think that that's, that's the power of what we're trying to do as a collaborative, I think, is that to be able to know who's, to be able to know, oh, Josh knows these guys, so let me call Josh and, figure it out, and to know Crystal's going to be working in Yuma and Ray. There's no shortage of people for the classes. It's just a matter of how we can best leverage what we're doing together. Don't you think?
Absolutely. Absolutely.
Well, that's very cool. Congratulations on doing that work, because that's important. So, and it's a great way to do that. So another wonderful transition is time to talk some marketing. This is the point where we wanted to have you all give us input on what's working, what's not working. I think a good place to start is what Crystal's talking about, and I know Monica's doing this as well in terms of connecting and working with healthcare providers, which a few years back none of us would have been talking about. So talk about a whole new way to approach people and fill classes. Working with healthcare is definitely it, at least top of the list, if not the only, not the only thing, just one of the things. So anybody else want to have questions, answers, ideas?
This is Connie. One thing I want to mention is that I've kind of mentioned this before a little bit, but with our focus on the grant being not only older adults but adults with disabilities, and the fact that our division within the Department of Human Services is now there's been some reorganization, and we're part of what is now used to be called the Office of Long-Term Care, which it's changed, sort of shifted a little bit, and is now the Office of Community Access and Independent Living. So the section that deals with vocational rehabilitation is also part of our office now. And so that's another reason why I want to try to get more folks who are in the disabled community into our classes. So I put a plug before into people considering as many opportunities as possible for classes that people who are working could attend, so scheduling evenings or weekends. So just wanted to mention that again. And see if anybody had any comments about that or concerns or questions.
Connie?
Yes.
This is Mary Pat at COA.
Hey, Mary Pat.
Hi. I have been here. I just wanted to mention that Joni is working on a class with Advocacy Denver. We've done several classes with them in the past, and they serve a special needs population, adult population. And so we are looking to have a class with them probably starting in June. So I just wanted to give you a heads up that you'll be able to see some numbers there.
Great, that's good to hear.
This is Eve over at Second Heck in Pueblo.
Crystal and I just wanted to mention that it's a constant struggle to figure out what the best outreach is. And one of the things that we've had really good luck with are putting out press releases. So if people aren't using press releases, it might be something to consider, and realizing that every community is different. It may not work in all communities, but it seems to be working for our community.
Thanks for mentioning that, Eve. What kinds of press releases, what information have you put out in your press releases?
Well, they're brief. Essentially, we're just letting them know the classes, the class type, just basic information. And we put it out. We try not to put it out too far out because people tend to forget. So maybe I would say, maybe a week or two, a week to 10 days prior to the class, we're putting them out.
And within the press release, we include information about what's going to be discussed in the workshop. And for this, we just started a DSMP class, and we had a huge response. In fact, I think we're still getting phone calls on it, and it was in the paper one day. So we actually had to cut it off because it got so huge.
Wow.
That's a good problem. That's a very good problem.
It is. It is. That was with the diabetes program. The chronic disease is a little bit more vague for the community to understand, so we haven't had the same response for the chronic disease. But we try to keep it really brief, but at the same time give them information so that they'll have a sense of what's actually going to take place in the class.
That's great to hear. I had drafted a template is a little bit too strong a word, but a basic press news release that people could use that I believe Lindsay Blackwelder sent out quite a while back to everybody that you could use in your communities, or I can also see what we could do from here to help with that process. It's a big part of my background. So if anyone would like to, maybe I could send that out to everybody again. And if anybody would like some help with theirs, please let me know. The two basic ways that I think would be of doing this would be just exactly what Eva's saying, and that was that kind of basic, short, sweet. Here's a class, who it's for. This is who it's for. This is how you get more information, that kind of thing. And you might, I don't know what you've put in yours, Eve, but for the CDSMP, I know exactly what you're saying about it being harder for people to kind of latch onto this being something that I could benefit from. But if you haven't, you might consider putting in a list of some of the more common conditions that people have, because that, then they could go, oh, it's for people with arthritis, or oh, it's for people with depression, or whatever, the heart disease, et cetera, and that can catch people's eye. If diabetes is so easy, and that comes up in the headline, so automatically someone with diabetes is going to go ahead and read that. So it is a little bit harder with a long list of conditions. But
we can ask, Crystal can send you a copy of what she has sent out if you'd like for her to do
that. That'd be great. That'd be great. And the second, if I could just mention before I forget, the second way of doing this is a little bit longer, like what's called a feature release, which focuses more on the story of somebody's story, and then gets into this is from a class, and this is how you find out about it and that. So again, those client stories can really capture people's attention, and both are legitimate ways of doing these news releases. The feature tends to be longer. The short and sweet, who, what, when, where, why, shorter, and that can go, especially in smaller communities, they'll have the little column about what's happening in the community, or a community calendar and that kind of thing, and that fits really well into those areas. So,
yeah, and you know what? It was not anything of our doing. And whenever we sent one of the press releases for chronic disease over to the newspaper, they titled it a workshop for caregivers of people with chronic conditions. And for the chronic disease, we got so many people in that class because it also included the caregivers. So, because it can be somebody with a chronic condition or somebody that takes care of them. So that's another thought too. If people are having a hard time filling in their classes, maybe emphasize it's also for the caregivers.
Yeah, it's a matter of using some key words, and if you're going to feature someone, that might make a little bit of a difference. It depends on the newspaper, because they're going to charge you for that. They're going to, in our community, they're going to decide how much they want to put in. So some communities may charge, others may not. But if you're going to feature somebody, I would imagine that, anyway, our community would probably, it depends. I don't know if there would be a fee for that, but we might want to anticipate that.
Yeah. Well, the fee would only come in if they consider it advertising. If they consider it news, it's news, and they don't charge for news. They might try to get you to do it as an ad, but that's a different thing. If they're charging you, then you pay for the ad space and you can say whatever you want within that space. So, I can help you with that as well if you would like. But the feature stories, newspapers like feature stories about somebody, and so if they are persuaded that this is an interesting news story, there shouldn't be a charge for it. But, newspapers survive on advertising, so if they see an opportunity, they may try to parlay that into a paid ad. But
exactly. Yeah, exactly.
Excuse me, Crystal?
Yes.
Hi, this is Monica. I remember when we were first starting, we tried to advertise through the Pueblo Chieftain, and not really advertise, but anyway, we really, really, really had a hard time getting through to them that this was an article and not an advertisement, or not, to advertise it. And I never won with them because they just would not run it. So I know with them, without paying for it. So I know with the Pueblo Chieftain, it's really tough.
Yes.
So Monica, I kind of just gave up with them.
Yeah. Monica, this is Eve. You're correct. It's not always as easy as we think it's going to be. So
right.
You might want to communicate with us, with maybe Crystal at some point, and maybe we can help with that. I'm not sure. Sometimes it helps to know the staff over at the Journal. We have one in particular that works with us fairly well.
Oh, great.
Yeah, we can always give you that name.
Okay,
yeah,
because I know. No, go ahead.
Monica, I'm sorry. It seems like whenever we've had luck with one or two articles, we sent it over as an editorial, and that's whenever we were able to get it published without having to pay anything. So it may just be even the wording when you're submitting it.
Yeah.
So we can chat offline, and we can discuss it more.
All right, that sounds great.
Yeah. Let me suggest, and Connie, maybe this is something you could help them with, is if you all approach them as two separate organizations serving that part of the state, and all of the about the partnership and about the broad reach between the two programs in terms of geography and the age groups and the type of conditions, you might have a good shot at a feature that way, because they like to show those kind of things, especially if you approach them with an idea and then they like the idea and follow up on it, then it becomes their idea. And so then it's easier to sell it if you give them the idea and then they own it, And to do something where it's not just Pueblo approaching them or Alamosa, that the whole valley might be workable. You never know.
Yeah, that's a great idea.
If I could ask just a couple follow-up questions to Eve, when you sent that over to the paper, do you know where it went, where it was sent? Meaning, advertising and news are separate staff, so.
You know what? Crystal has actually been the one doing that, so I think it would be valuable if you chatted with her offline. We can talk with you a little bit about that.
Okay.
Yeah, and often whenever, because we serve 16 counties, so sometimes press releases need to go further than Pueblo, I physically called all of the newspapers and asked, okay, for an editorial, where does that go to? For a press release, where does that go to? And sometimes it's news, sometimes it's press release, sometimes it's a person. So I think physically picking up the phone and calling the newspaper to ask works much better than relying on the website to feed you the information. And that's just a lot of times our mode of operation. We pick up the phone and call. And even, I mean, if I need to speak with somebody for more than just a quick little blurb, I'll call and say, I know I could send you an email, but it comes across better over the phone. So I called the newspapers to find out the appropriate path to submit it, and I think that's why we've had better luck.
Yeah. And Crystal, I agree with that too, because here in the Valley, you know, we've worked with them for all of our workshops. We go through them, so they pretty much know who we are, and there's no questions asked. So I tend to agree with that. If you just call and get personal with them, you know, more on a personal basis, it works better.
Well, and I think if you're giving them ideas that they can really run with, and they can come up with pictures that go with it, and they can tug heartstrings, and they can put it next to an ad to get some attention. You know, they are looking, frequently they're looking for things, for stories like that, as opposed to just a calendar listing. Especially that's true in the small papers that, or the smaller community papers.
Yeah.
Well, and I think if something is really well written, I mean, we've had one of our coworkers submitted a story, and they used it word for word, and they put one of their guys' names on it because it was so well written. So I think if you have somebody in your organization that can do a longer story and really make sure it's a lot of good information, you have a pretty good chance of it being put in, depending on the paper size if they need more stories. And here our Monday stories are really, the paper is really small, so it helps to give them meat for that day.
Yeah.
Yes, exactly.
And along that same line, if you make it look, if it's more like a news story, if you like something that you could envision seeing as a news story, then it's more likely to be considered for on the news side of things. And there's, you know, they're used to a standard kind of format for a news release that, you know, says news release at the top for immediate release, gives a contact name and headline and all that. And, you know, and if you're including more, a little bit more, you know, referring to the Stanford University and some more meat to it in that way, again, that I could help you with, then that might help as well in persuading them that this is news, not just a paid ad, not just an opportunity for a paid ad, I mean.
Yeah.
But that's great news that you've gotten good response from that, and thank you very much for sharing your story.
Well, yes, definitely, thank you. And we have about 15 minutes left, so I wanted to check in and see if there are any other agenda items, anything else you all want to share or add to the call. And Katie, I don't know if you're still with us. If you are, if you want to give us any kind of update on what's new and happening in the world of HICPUF.
Yeah, I'm still on. The world of HICPUF is very busy with all of the expansion stuff going on right now. We also have the full benefit Medicare, Medicaid eligibility demonstration starting pretty shortly. So things are just crazy, but good.
Yeah, good crazy though. Well, so
yeah,
healthcare policy and finance is going to be really involved with the demonstration project. And how can we help with that? How can we that are doing the chronic disease programs and other evidence-based programs, how can we be a part of that?
You know, I was actually thinking about that. I know that you guys have worked with a couple of the RICOs, but I think some of the other RICOs might really be interested in some of the things going on. So I'm sort of wondering, we get together monthly for a quality subcommittee meeting to the ACC, and I'm wondering if anybody would want to come present on that and kind of talk about the successes that have already happened, just to kind of market it to the RICOs that haven't been involved already. I don't know
yeah.
who would be interested.
I think we would love to do that. And I don't know which of us, but I think as a group we would love to do that.
That would be great. Our May agenda is already pretty full, but I'm wondering June, let's see, we meet on the 25th. And I think that this would be a great conversation to have with that group. So maybe I can follow up with you after the meeting and we can decide who would want to come present and how long we need and go from there.
You know, that would be terrific. We've worked now with Colorado Access and Physician Health Partners. Physician Health Partners is doing a few referrals, but mainly what they're doing is embedding the program themselves, which is cool. And then Colorado Access. But I know that there's some others, like Crystal was mentioning, in other parts of the state. And I know, you know, on the western slope that Brittany and Sue have already been working with Rocky Mountain Health Plans over there. So we would love to get in front of the others and remind them.
Yeah, I think that would be great. I think they would be really excited about it too.
Oh, very cool.
All right, well then I will follow up with you after the meeting.
That sounds great. And then we'll, you know, anybody who's on the call, Connie, I know that this is one that you'll want to be involved with. And but if there's other folks that want to be a part of this, we can definitely do that. So let us know.
Lindsay?
Yeah.
Hi, this is Monica again.
Hi, Monica.
I just wanted to mention, I was just thinking of something that kind of was exciting too this way, but I had gone to Lucretia Smith and I, we're leaders from South Central Colorado, or out of South Central Colorado Seniors, and she is the SHIP and ADRC coordinator for our area. And anyway, she was invited to a nurses meeting through hospice, and she invited me to go with her and kind of introduce the program to her, or to them. And anyway, where that came from was, you know, the program was presented to them. There was a nurse there that also belonged to the Rotary Club in Monte Vista. And so she invited me to go speak to the Rotary Club for their noon meeting. So I did that, and so it informed them about the program. And then from that, there was a gentleman there that's on the ambulance committee, or he's on the ambulance group in Monte Vista. And anyway, then he gave me a name or two to contact to maybe present to the EMTs in the valley and let them know what's going on. Because, you know, with patients and stuff, sometimes they get patients or know patients personally that, you know, they could need this service and that type of thing, or this resource. And then it went from there to, of course, some of the EMTs, the ambulance services over in the other counties of the San Luis Valley. So one just led to another.
And so,
yeah. So
that's the way to network.
Yeah. So anyway.
See, Katie, we're everywhere.
Yeah.
I like to hear that.
Well, that's an exciting possibility. Thank you, Katie. I know we just have a couple minutes left, but I wanted to. I just wanted to say that, you know, we're all doing really, truly amazing work, and so it's very important that we all try and keep each other in the loop as much as possible. And so I think a really good way to do that is just to share, like Monica just did, about how one thing connected to another thing connected to another thing. I was doing a Fidelity visit a few months back in Dove Creek, Little Dove Creek, Colorado, and one of the leaders of the class is an EMT. And he knew every person in the class. It was a diabetes program. He knew every person in the class because he had been into their homes when they needed medical transport or when they had fallen, and he was there to help them be picked up, basically, a pickup, or he had been there to transport them to a hospital. But he personally knew every person in that class and had recruited several of them himself, and then had worked with other people to do that. So those things that you think are kind of the roundabout ways of doing things turn out to be really helpful in really establishing the long-term success of a program. So nice work, everybody.
And Lindsay, this is Connie again, and you just jarred my memory about something else, if I could mention real quick. We have gotten very few invoices for fidelity visits. So I guess I should send out an email to people asking who's going to be billing, because I keep putting some money into the budget. Other than COA's been good about sending in their invoices, but I have very few others, and if other people are covering those efforts through their own budget, that's great. But if you are going to be invoicing for, especially for this grant year, if it's for anybody who's not already been paid for one in the past, we need to get their information in our system right away because of that change that I mentioned earlier about our contracting system. So we want to get them in our accounting system is probably the best way to describe that. So is anybody on the call who is going to be billing for those that hasn't yet? Crystal, I know we talked about a couple, but anybody else?
Connie, did ours come through, the bill, the invoice?
I haven't seen it.
Okay,
We'll check with our billing person.
Okay.
Yeah.
On that.
The other issue is, okay, that'd be great. You know, if we're not going to spend that money, then I want to know that so we can see where it can be put to better use. So I'm not hearing from anybody else. So was anybody else going to say yes, we are going to, but haven't yet? That's on the call. Okay. All right. Thanks.
Okay, folks, we have just a few minutes left. Last minute comments, agenda items, anything else going on you want us to know about? Okay, well, we will be hearing back from Connie about where we stand as we move forward with the sustainability plan in a meeting, and we'll kind of table that till we know more. And we also will be just continuing on through the summer. So our next meeting is the Friday meeting, and that one is June 6th. And if you know anybody who missed today's meeting, I know that we've had some folks downloading these webinars, and so that is terrific. But, you know, hopefully we will see you all or hear you all on Friday, June 6th. And if there's anything in between now and then that you need, please feel free to reach out and be in touch. And good luck, Monica, on your training. That's very exciting. And I know we'll talk to the rest of you before the next group comes up, the next training opportunity comes up. And if there's nothing else, we'll go ahead and end the call. Last thoughts, anybody?
No, but thank you, Lindsay.
That's it. Thank you very much.
Thank you.
You're welcome. Happy spring.
Yeah.
Bye.
Bye.